San Francisco because Ash is here, and Ash is focused on hematology and on blood cancers. And I want to ask just a few of you, do you think there's something that's specifically unique for blood cancers? Can we pull those out in any way?
I do think that for blood cancer patients, the value proposition is magnified. We don't have known preventions, we don't have known screenings for these blood cancers. Patients are dependent upon therapy. They're dependent upon innovation in therapy. So those benefits of a given therapy are that much more critical to a patient, as well as the costs, which are critical because a lot of these innovations come with a price. They're expensive, and so if a patient can't afford access to that therapy, then the value proposition diminishes.
The added complication we see, particularly in the lymphoma space, is the fact that this is an incredibly complex diagnosis. We often see patients at the Lymphoma Research Foundation, unfortunately, who arrive at our programs knowing that they've received a non-Hodgkin lymphoma diagnosis, as an example, but nothing beyond that. They've not been educated about their specific lymphoma subtype. And so when we think about value, decision-making, and communication regarding quality cancer care between a patient and their physician, if a patient's unaware of their specific diagnosis, it only adds to the complication and I think results in a system that doesn't best serve the patient. And so I think that that's an added complication we in this space face on a daily basis.
So at the societal level, hematologic malignancies typically affect children and elderly. So it's very particular populations, a lot of heterogeneity, a lot of comorbidities, and that brings specific and several challenges along with it. I think it's also incredibly complex to define value in an area where the populations are extremely niche. And so there do have to be unique characteristics. It's an area where we haven't seen a lot of development of personalized medicine as of yet. And so as we begin to understand it a lot better, I think that value will be refined in a different manner over the next 10 years.
And I think that's where big data will come in. I mean, if you look at the last 10 years, for example, we've doubled survival rate and life expectancy of multiple myeloma as treatments become more targeted. What we need now, because so many tumors are heterogeneous, and we need to match the patient to the treatment and do two things with it. First, stop with the outdated randomized clinical trial system, which delays things to market. And secondly, use that data to match the right patient to the right treatment, because most of the cost in healthcare is doing it right the second or third time. So if we can do it right the first time, it frees up a lot of time and money for patients and for the reimbursers. And I think that's where I think we can get even more value for patients.
You're saying to try and accelerate the process in blood cancers. Yeah.